Bismillahirrahmanirrahim. The topic for today's discussion is acute appendicitis. Acute appendicitis means acute inflammation of the appendix. Inflammation of the appendix is called appendicitis. Whenever there is an inflammation, we usually add TIS to the organ involved. So appendicitis means acute inflammation of the appendix. How will we diagnose this case that this is an acute appendicitis? It depends on the clinical presentation and some baseline investigation. How the patient will present, usually the patient with acute appendicitis will present with pain in the right iliac fossa, usually associated with nausea, vomiting, and mild fever. Whenever you come across with such a case in which the patient having a pain in the right iliac fossa associated with nausea, vomiting, and fever, you proceed with the examination. An examination, there will be tenderness in the right iliac fossa. Tenderness mean when you palpate the right iliac fossa, patient will feel pain there. Apart from palpation, there are some basic signs which may be positive in acute appendicitis, like rousing sign, SAS sign, pointing sign, and obturator sign. Now we will order some investigation which include baseline investigation like CBC and ultrasound. CBC will shows neutrophilic leukocytosis, and ultrasound will show acute and inflamed appendix. Also the radiologist will show you in report that there is probe tenderness and acute inflammation of the appendix and ultrasound. Now this we have diagnosed the case of acute appendicitis. Now we have to proceed with how to treat this case. Usually acute appendicitis needs surgery. For surgery, we have to prepare the patient and proceed accordingly. For preparation, the thing which we need is the patient should have not taken solid meal for more than for 4 hours or liquid meal for 2 hours. So if the patient has taken meal, we should avoid surgery for 2 to 4 hours. We should NBM the patient. NBM means nothing by mouth, not nil by mouth. If the patient is NBM, we will shift the patient to OT, operation theater, and will prepare the when the patient is shifted to OT, then you scrub yourself along with your assistant, prepare the trolley in which the instruments which we needs, and lay down the patient on the OT table and ask the anesthesia team to induce the anesthesia. When the anesthesia induction is given, you drape the patient, and the next step will be in the next video.